Hi everyone, I'm going to be presenting a slideshow on hypothyroidism. My name is Brittany Hamlet and I'm in EXS 486 at Westchester University. The thyroid gland is a butterfly-shaped gland located in the anterior portion of your neck, which means that it's almost close to the skin right here, not toward the back of your neck. If you're a male, it would be about 2 inches below your Adam's apple. So if you're a male, your Adam's apple will be about here. It will be right about here, your thyroid gland. It regulates the metabolism in your body, so it releases hormones T3 and T4 that I'll talk about later in the slideshow. And these hormones help to increase energy expenditure and burn calories. So more into the pathophysiology of it. The thyroid releasing hormone is released from the hypothalamus. So thyroid releasing hormone is what produces thyroid stimulating hormone, and then from thyroid stimulating hormone releases T3 and T4. Together they're called thyroid hormone, T3 and T4 together. So usually during tests and blood tests and stuff like that, thyroid releasing hormone, abbreviated as THS, and T3 and T4 are the ones that show up on a test. So if your thyroid is not producing enough thyroid hormone, T3 and T4, it's called underproducing, and it's referred to as hypothyroidism. This is just a chart demonstrating normal thyroid levels. So the units are milli-international units per liter. There's sometimes different units that can be used, like ng per liter, but this graph shows it in this. So T3, a normal range would be 80 to 220. So anything under 80 would be hypothyroidism. Anything above 220 would be hyperthyroidism, but I'm not going to talk too much about that. T4 would be anything from 4.5 to 12.5 would be normal, and anything below 4.5 would be hypothyroidism only if TSH is above 3. So the two kind of counter-interact each other. TSH would be high and T4 would be low, and that would tell you that you have hypothyroidism. Some statistics to just give you a better idea of how many people this affects. 20 million people in America have some form of thyroid disease. A lot of times you hear this in women because they're 5 to 8 times more likely to have something wrong with the thyroid. There's different kinds of thyroid things that I'm not going to go too much into in this presentation, but there's Hashimoto's, thyroid cancer, hypothyroidism, and hyper. A lot of hyper and hypothyroidism are the opposite of each other. So going back to the stats, 60% are unaware that they have the disease, so they may have the symptoms, but they just either haven't got blood tests done or anything to that nature, and 1 in 8 women will develop a thyroid disorder at some point in their lives. So these are two graphs that just go into a little bit more of the statistics. The first graph is showing thyroid problems among women aged 20 and older by race ethnicity. For the most part, ethnicity doesn't really seem to make a huge difference on the percent of women that have a thyroid disorder. Most of them are pretty much non-Hispanic white is 18.5, non-Hispanic black is 10.7, Hispanic is 9.2, and non-Hispanic other races is 15.7. So for the most part, for stats sake, they're all around the same. There's not one ethnicity doesn't really have it more than others. So the bottom graph is physician visits by adults aged 18 and older due to endocrine and metabolic disorders. So this is just kind of giving you an idea of how many people that have endocrine disorders have thyroid disorders, because the thyroid is part of your endocrine system. So the pink bars are females and the gray bars are males, so it's showing you that people with thyroid disorders, more women have it than males. And then disorders of the endocrine gland, it's 3.1 and 4.0, so pretty equal for the most part. And just metabolic and immunity disorders in general, pretty similar too, but both of them have males as more, but disorders of the thyroid gland have women more. So just going back to the original, that idea that women are more likely to have a thyroid disorder. Some symptoms of having a thyroid disorder, specifically hypothyroidism, are tiredness and fatigue, so extreme feeling like you can never get enough sleep, weight gain, this goes back to the energy expenditure portion, difficulty concentrating, dry skin or hair, or also lack of hair, like thinning hair and different patches and stuff like that, sleeping issues, either waking up, not being able to fall asleep, depression, this could be attributed to all of the symptoms listed above, sensitive to cold, frequent heavy periods in women, because your endocrine system does relate back to hormones and all of that, and joint and muscle pain. Some treatment for a thyroid disorder would be, first of all, oral medications. The most common is levothyroxine, and a really common type of a levothyroxine is Synthroid. So this is supposed to restore your hormone levels depending on your dosage. So a physician will prescribe you a certain dosage depending on how off your levels are or how much they've seen your levels change. And so it attempts to counteract the symptoms of hypothyroidism. It also can be treated for hyperthyroidism, but I'm not sure if it's a different drug or how. I think Synthroid can be used for both. It's just trying to bring all your hormone levels back to normal. So your physician checks levels every 3 months in order to assess the dosage and timing, like I mentioned. An alternative that's thought of to be more natural than the levothyroxine is pig thyroid. So it's not regulated by the FDA though, so most people with thyroid disorders are more likely to take the Synthroid or levothyroxine. Also, another treatment that's very common because it is related to energy expenditure, exercise is usually prescribed by the doctor in order to try to combat the weight gain and sleeping issues along with the fatigue. So some risk factors for hypothyroidism is if it runs in your family, even if anyone in your family has an autoimmune disorder like rheumatoid arthritis, type 1 diabetes, lupus, anything like that can relate to someone else in your family having hypothyroidism. Thyroid surgery, so having previous thyroid cancer or a tumor in your thyroid could cause you later in life to have hypo or hyperthyroidism. Usually hypo is more likely because hypo is underactive. So again, any cancer or radiation to your neck or upper chest that would cause this. And also just if you're a female above age 30. So in order to diagnose hypothyroidism, it can be caused most commonly by thyroid disease known as Hashimoto's disease. So Hashimoto's is a type of autoimmune disorder, so it kind of relates back to the slide before. All of the ones mentioned were autoimmune disorders. So your thyroid is basically destroyed by antibodies and lymphocytes that are not recognizing your cells in your thyroid to be self. So that's what an autoimmune disorder does. Your antibodies start attacking your self cells because they no longer recognize that they're part of your body and they're not foreign. So first, in order to get a diagnosis, you'd be evaluated by a physician. They would review your symptoms, medical and family history, give you a physical exam, feel for any lumps or visible symptoms that we previously mentioned, like the hair loss or any lumps in the area in your neck. And then they would do a TSH test. And during a TSH test, they would also measure T3 and T4. So this is the case study portion. So the patient is a 46-year-old woman, and she's going to her family practice doctor just complaining of general symptoms of extreme fatigue with a lot of sleep troubles, weight gain without much of a change in diet or lifestyle, hair thinning and loss, and she's a non-smoker, she's physically inactive, and has a high resting heart rate. Depending on the day, can be classified as tachycardic. She has a family history of diabetes and heart disease, and her blood pressure is normal at 122/78. So from here, the physician takes her blood work. All of her cholesterol levels come back normally, but her thyroid levels, the physician notices that T3, T4, and TH levels indicate an underactive thyroid. Her T3 was 68, so this reverts back to the chart at the beginning of the slideshow. Her T3 was 68. T4 was 2.34, so that's low, and then her TSH is above 3 at 5.31. So this indicates that she has hypothyroidism. The physician treats her with a medication called Synthroid that I talked about previously, but she also gives her an exercise prescription and recommends going to a trainer at a local gym or just slowly getting more into exercise since she's is previously inactive. And so this would be her form of clearance before going to an exercise facility. The exercise prescription would look something like this. At least 5 days a week, she would be performing any kind of aerobic exercise. It would be moderate, so 40 to 75% heart rate reserved. At the bottom of the chart, I defined heart rate reserve as your heart rate max minus heart rate resting. So in her case, since her heart rate resting is already a little bit higher, hers would probably be more on the light to moderate side to start for aerobic exercise until her resting heart rate hopefully begins to go down with aerobic training. These sessions would be 30 to 60 minutes a day, and like I said before, any type: running, walking, cycling, swimming, whatever her choice of exercise would be. For resistance training, the doctor recommends, or the trainer recommends, 2 to 3 days per week. So I describe the intensity as moderate intensity, so each exercise would be 2 to 4 sets, 8 to 12 reps, and then 2 to 3 minutes rest in between sets. So moderate intensity would be 40 to 60% of the amount of weight you could lift once, which is referred to as your 1 rep max. So for example, if she was doing a squat and her one rep max was 100, so she would work her way up with about 40 to 60 pounds on her bar until for each of these. The time, it depends on the muscles and exercises used. Usually on a lower body day where there's more muscles to be activated, it would probably take her a little bit longer, so that can vary. And the type would be multi-joint and more than one muscle group in one day. So for example, she could do back and biceps on one day or shoulders and triceps on another day. And for flexibility, just for maintenance purposes, since she will be doing aerobic exercise and resistance exercise, the flexibility would be 2 to 3 days a week and to hold for 20 to 30 seconds. Here are just some links for more information. The first one is from the American Thyroid Association, the second is from the National Academy of Hypothyroidism, and the third one is just an About Your Thyroid overall general website. And lastly, these are my references, and that is it. Thank you for watching.